Welcome to this presentation on diabetes. This lecture will focus on diabetes from a clinical and laboratory perspective, with emphasis on disease mechanisms, diagnostic criteria, monitoring, and the essential role of the medical laboratory scientist in patient care. Diabetes mellitus is a chronic metabolic disorder characterized by persistent hyperglycemia. It occurs due to defects in insulin secretion, insulin action, or both. If not properly managed, diabetes leads to significant acute and chronic complications, making early diagnosis and ongoing monitoring essential. There are several types of diabetes. Type 1 diabetes results from autoimmune destruction of pancreatic beta cells and typically requires lifelong insulin therapy. Type 2 diabetes is caused by insulin resistance combined with relative insulin deficiency and is strongly associated with obesity and lifestyle factors. Gestational diabetes develops during pregnancy and increases the risk of future type 2 diabetes. Other less common forms include genetic and secondary causes related to pancreatic disease or medications. In diabetes, inadequate insulin activity leads to reduced glucose uptake by cells and increased glucose production by the liver. This results in hyperglycemia. Clinically, patients experience polyuria, polydipsia, and polyphagia. Over time, chronic hyperglycemia causes damage to blood vessels and organs, leading to both microvascular and macrovascular complications. Patients with diabetes may present with classic symptoms such as excessive urination, excessive thirst, increased hunger, and unexplained weight loss. Chronic complications include diabetic retinopathy affecting vision, nephropathy affecting kidney function, and neuropathy affecting peripheral nerves. Diabetic patients are also more susceptible to infections due to impaired immune function. Laboratory testing is central to the diagnosis of diabetes. Diagnostic criteria include a fasting plasma glucose of 7.0 millimoles per liter or higher, a 2-hour oral glucose tolerance test result of 11.1 millimoles per liter or higher, or a random plasma glucose of 11.1 millimoles per liter or higher in the presence of symptoms. An HbA1c value of 6.5% or higher is also diagnostic when measured using standardized methods. Ongoing laboratory monitoring is essential for effective diabetes management. HbA1c is used to assess long-term glycemic control over approximately 3 months. Fasting and postprandial glucose measurements help evaluate daily control. Lipid profiles assess cardiovascular risk, while urine microalbumin detects early diabetic nephropathy. Ketone testing is particularly important in type 1 diabetes to detect diabetic ketoacidosis. Diabetic complications are divided into microvascular and macrovascular complications. Microvascular complications include retinopathy, nephropathy, and neuropathy. Macrovascular complications involve large blood vessels and include cardiovascular disease, stroke, and peripheral arterial disease. These complications significantly contribute to morbidity and mortality in diabetic patients. Medical laboratory scientists play a critical role in diabetes care. Responsibilities include accurate measurement of glucose and HbA1c, strict quality control procedures, analyzer maintenance, and timely reporting of results. Laboratory professionals also support clinicians by ensuring reliable data for diagnosis, monitoring, and treatment decisions. In summary, diabetes is a chronic metabolic disorder with serious health consequences if poorly controlled. Laboratory testing is essential for diagnosis, monitoring, and early detection of complications. As medical laboratory scientists, your role is vital in ensuring accurate results and contributing to improved patient outcomes.